In this shot, we want to walk you through the part of the hip bone which is associated with the lower limb. As you recall, the hip bone is formed by the union of ilium, the pubis, and ischium. These three join together at the bottom part of this area known as acetabulum. Now, the part of the lateral surface of the ilium, this surface is known as gluteal surface. Then you can imagine this area is associated with the gluteal region that we will see with the lower limb. Also, on the acetabulum, we have an articular surface right there, which is moon shape. Then we call that lunate surface that articulates with the head of the femur to form the hip joint. The bottom part here is called acetabular fossa, right? And then right there, acetabular notch that bridges by the transverse acetabular ligament, right? So right there. Then you can imagine the some of the arteries passing through this hole to get to the head of the femur. The other part of the bone that associated with the lower limb right here is the superior ramus of the pubis, and this part known as pecten pubis that gives attachment to the pectineus muscle, and also the obturator foramen is occupied by the obturator membrane. Then you can imagine the obturator externus muscle and internus attaching to the obturator membrane. The externus is on the lateral surface or external surface, and obturator internus from the inside. The other part of the bone associated with the lower limb, right there, this bump, the anterior superior iliac spine. This is the iliac crest, and this anterior superior iliac spine, or ACES. The sartorius muscle attaches here. That is associated with the lower limb bone as well, or lower limb skeleton. On the ischium right there, we have ischial tuberosity, and later we will see that gives attachment to the hamstring muscles. Okay, the hamstring muscles. The next bone that we want to study is the femur, the bone that forms the skeleton of the thigh region. Femur bone is a long bone, and keep in your mind, anytime that we say a bone is long bone, it has two ends and a shaft or body. The ends are referred to as epiphyses and the shaft as diaphyses. Okay? Now, let's go with the proximal end or superior end of the femur. Okay, so I'm going to hold like that. That is like an anatomical position that we are looking at. So on the proximal end, we have a round surface known as the head, and on the head there is an impression known as fovea. The fovea gives attachment to a ligament, round ligament of the head of the femur, or ligamentum teres femoris. The head is attached to the rest of the bone by the neck, so then this area is the neck. Okay, and then there are two bony projections known as trochanter. The greater trochanter on the upper lateral side, and the lesser trochanter, which is a little bit leaning to the posterior aspect of the proximal end. Okay, these two trochanters are connected to each other on the anterior aspect by a line known as intertrochanteric line, and then on the posterior side they are connected by intertrochanteric crest. So since we are in the crest, it's good to know that on the intertrochanteric crest here there is a bony projection. You see a little bit bumpy here, known as quadrate tubercle. Quadrate tubercle. Okay, now in regards to the greater trochanter, you can see that there is an impression right here. There is a small impression, is known as trochanteric fossa, which is located between the neck and the greater trochanter. Trochanteric fossa, and that is the medial surface of the trochanter, the greater trochanter. And of course, that is the lateral surface of the greater trochanter. Okay. Now, we move down, we get to the shaft of the bone, okay? Or the body of the bone. So I'm going to hold the bone like that you can see the entire shaft. So the shaft is, as you can see, is kind of round. Then on the posterior aspect of the shaft, there is a bony projection here, right here, known as linea aspera, or rough line. Linea aspera. So when we follow, actually the linea aspera has two smaller parts known as lateral and medial lips. Following them superiorly or proximally, the lateral lip of the linea aspera moves laterally, and then on this part right there, there is a kind of a little bit rough area known as gluteal tuberosity. Gluteal tuberosity. It is kind of the little bit rough area here that reaches to the lesser trochanter, and that little part is known as pectineal line. Pectineal line. Practically, pectineal line gives attachment to pectineus muscle. Okay, so that was the shaft. Now we go with the distal end, and again, if you want to see better view of the distal end, maybe I can hold on the bone in the anatomical position, and then we can see better view of the distal end. So on the distal end, there are two articular surfaces. I'm going to actually look at the posterior aspect. These two, known as medial and lateral condyles. This is the lateral condyle, because look at here, this is the greater trochanter. Remember the head, medial? So always look at the head to find the medial versus the lateral side. So that is medial condyle, and that is lateral condyle. Okay? And there is a notch here between the condyles, intercondylar notch. Now, superior to each condyle, there is a bony projection known as epicondyle. So that is medial epicondyle right here. And then on the other side, we have the lateral epicondyle. Lateral epicondyle. So look at the other femur here. Right there, that bony projection is more clear, and that is referred to as adductor tubercle. Adductor tubercle. The adductor tubercle gives attachment to adductor muscle, adductor magnus muscle. Okay, going back to the distal end again. On the anterior aspect of the distal end, we have the articular surface, which is located between the condyle. This is referred to as patellar surface. Then you can imagine that this patellar surface articulates with patella to form the patellofemoral joint. Okay. Now, before I finish with the hip bone, good to know that the head of the femur articulates with the acetabulum. Actually, with more detail is the lunar surface of acetabulum, right there. That articulates with the head of the femur to form the hip joint, and this joint is a ball and socket joint that has several movements, or movements in several directions. Then when it comes to the distal end of the femur, that distal end articulates with the tibial condyle. That is tibia. Later we will see one of the leg bones, and these are the tibial condyle that articulates with the femoral condyle, and they form the knee joint. There are two bones in the leg region. The one on the medial side is known as tibia, and the one on the lateral side is referred to as fibula. Both of them are long bones. Then it means they have two ends and a shaft or body. So first, let's go with the tibia. Remember, tibia is on the medial side. Okay. Now, on the proximal end of the tibia, I'm going to hold in the anatomical position that you can see better. So on the proximal end, we have two actually parts, one on each side, known as condyles, the tibial condyles. So if you want to orient yourself to the tibia, remember that bony projection on the distal end is referred to as medial malleolus. Okay, we are going to examine that with the distal end, but that's on the medial side. Then always look at medial malleolus. Then you can see, or you can say actually, this is the medial condyle, this part, and this one is the lateral condyle. Okay. Now, when you look at the superior aspect of the medial and lateral condyle of the tibia, we have articular surfaces known as plateau, and then see that there is a little bit impression here, that these two impression articulates with the condyle of the femur. They form the knee joint. Okay. Now, back to the condyle. There is a bony projection between the condyle right here in the midline, known as intercondylar eminence, and the intercondylar eminence has two little bony projection known as medial and lateral tubercles. Medial, this one, and this one, lateral tubercles. So there is an area between the tubercles. Actually, I'm going to hold the bone here, that this is anterior side. So there is an area between the tubercles, that area right there, okay, and another area right here. So they are referred to as intercondylar area, anterior and posterior intercondylar area. These two areas are really important because they give attachment to the cruciate ligaments inside the knee joint. Okay. Now on the anterior aspect of the proximal end of the tibia, there is a bony projection here right there, really prominent, known as tibial tuberosity. Tibial tuberosity. That tuberosity gives attachment to patellar ligament or patellar tendon. I like to call that patellar ligament or tendon, and there is a reason behind that. It's called ligament because it attaches bone to bone, or we can call that tendon when we take the tendon reflex. Okay. Anyway, so I'm going to actually go with these two condyles to cover a little bit more about the condyles. The lateral condyle on the anterior aspect, there is a bony projection here right there, which is really prominent, is known as the Gerdy's tubercle. Gerdy's tubercle. That tubercle gives attachment to iliotibial band or iliotibial tract. Going posteriorly, there is an articular surface. You see that, a small articular surface here that articulates with the head of the fibula. And then going to the medial side, now we are looking at the medial condyle. Remember, always medial malleolus, then that is medial condyle. On the posterior aspect of the medial condyle, there is an impression here for semimembranosus muscle. Okay, that was about the proximal end of the tibia. In regards to the shaft of the tibia, good to know that the shaft has 3 borders and 3 surfaces. Usually, actually, the long bones shaft has 3 borders and 3 surfaces. So, for the borders, I want you to just focus on the anterior border, which is really sharp. And if you palpate your leg, you can palpate that sharp border on your own leg. The medial surface of the bone is subcutaneous, means is under the skin. If you actually tap on the medial side of your leg on the anterior side, you can feel that, you know, that surface is right under the skin. And then the lateral border of the shaft, which is not as sharp as the anterior border, but is almost sharp, and that gives attachment to interosseous membrane. That interosseous membrane actually is located between the fibula and tibia. So they were the borders that I want you to focus on. Now, when it comes to the surface, on the posterior surface, there is a line on the close to the proximal end, right? This line, known as soleal line. Soleal line. This line gives attachment to soleus muscle. Now, there is a small triangular area above the soleal line right there, which gives attachment to popliteus muscle. Okay, so that was the shaft. Now we want to go with the distal end of the bone. Okay, so on the distal end of the bone, there is a bony projection on the medial aspect right there, known as medial malleolus. Right there, medial malleolus. Okay, and then medial malleolus on the inner surface right there articulates with the talus, one of the bones of the foot. So I'm going to actually walk you through different aspects of the distal end. On the anterior aspect is like a smooth surface, is not very important bony landmark. On the lateral side right there, we have a notch known as fibular notch, and you can imagine that fibular notch articulates with the fibula. So I'm going to actually articulate these two bones together at the end, that you can see how they articulate. Fibular notch. On the posterior side of the distal end, there are some grooves for the muscles, and then on the medial aspect, as you recall, we have the medial malleolus. The distal aspect of the distal end right here, hopefully you can appreciate that surface is smooth and it forms the ankle joint that articulates with the trochlea of the talus that we will see in a second. Okay, now I'm going to actually put the hip at the tibia like that, and hopefully I can articulate the fibula with the tibia easily like this. And you see that fibular notch articulate with the fibula. And this is the way that they articulate together. Patella is also one of the lower limb bones, is a triangular bone located within the tendon of quadriceps muscle. Hence is known as a sesamoid bone. Sesamoid bones are the bones that grow within the tendon of the muscles, and patella is the largest sesamoid bone. That triangular shaped bone has a base, an apex, the lateral and medial borders. The anterior surface is rough, that gives attachment to the apex, actually gives attachment to the patellar ligament, and also is under cutaneous here. But the posterior surface is a smooth, and it forms the joint, the patellofemoral joint. So we can actually articulate that smooth surface with the patellar surface of femur. These two bones do not belong to the same individual, that's why they are not completely matched. But this is the way overall that they articulate together. Okay? The other bone of the leg is fibula, which in anatomical position is located on the lateral side of the leg. So I'm going to remove the tibia and focus on the fibula. So fibula is a long bone as well. So then it has two ends, the proximal end and distal end, and a shaft or body. So let's focus on the proximal end. Okay, so when it comes to the proximal end, this end has a kind of the round part known as the head, and then under the head we have the neck. Okay, and on the head, the most proximal part of the head is known as apex. If I hold the bone like that, you see that that is the most proximal part of the head. So that is known as apex. Okay. So the shaft of the fibula is really complicated. We don't want actually to go with the border and surfaces, but overall it has 30 surfaces, and each surface is associated with one of the compartments of the leg, anterior, posterior, and lateral compartment of the leg. So going to the distal end, that the distal end, the entire distal end is known as lateral malleolus. Lateral malleolus. So then on the medial aspect of the lateral malleolus, we have articular surface here that articulates with the talus. And posterior to that, right here, we have an impression known as malleolar fossa. That malleolar fossa gives attachment to the ligament. Now, I'm going to actually put the tibia and fibula together. I have another specimen here. So I'm going to focus on distal end right there. Okay, as you can see, this is the way that tibia articulates with fibula. The tibia, the fibular notch of the tibia with fibula. And then here is the medial malleolus right there, and that is lateral malleolus. Now I'm going to actually put the foot bones here, and that is talus, we will see in a second, and this is the way that they articulate together. Then practically here is the ankle joint, and then later we will see the movements of the ankle joint or dorsiflexion like this and plantar flexion like that. Okay, dorsiflexion and plantar flexion. Foot bones are divided into three groups: the tarsal bones, the metatarsal bones, and phalanges. In the tarsal bones, or the tarsal bones are divided into three groups. In the proximal group, we have talus, this one, and calcaneus. The intermediate one, or the intermediate layer or group, includes the navicular bone, this one. And on the distal side, or distal group, we have cuboid and cuneiforms. Okay? Then proximal, intermediate, distal. These are tarsal bones. Then we have metatarsal bones, 5 metatarsal bones. We number them from medial to lateral. Number 1 always towards the big toe. 1, 2, 3, 4, 5. And each metatarsal bone includes or has the base, shaft, and the head. And then the only thing that I want you to remember about the metatarsal bones is this bony projection of the 5th metatarsal bone, which referred to as tuberosity, the tuberosity of 5th metatarsal bone. That is a bony landmark. It gives attachment to muscle. When it comes to the phalanges, the big toe has 2 phalanges, the proximal phalanx and distal phalanx, whereas the other toes actually have 3 phalanges: proximal, middle, and distal phalanges. Okay, so then practically, if you want to name these joints, here are the metatarsophalangeal joints between the metatarsal bones and proximal phalanges. Okay, then we have the interphalangeal joints. For the big toe, just 1 interphalangeal joint. However, for the other toes, we have 2 proximal and distal interphalangeal joints. In the proximal group of the tarsal bones, we have talus and calcaneus. Let's learn a little bit more about the talus. Okay, so I have a separated talus here that I can put under the camera that you can see. Okay, so when it comes to the talus, it has 3 parts: the head, the neck, and the body. The superior surface of the body looks like a pulley known as trochlear surface that articulates with the distal end of the tibia. So I can put the tibia here, see that right there, articulates with the distal end of the tibia. Then the shaft on the lateral side articulates with the lateral malleolus, and on the medial side articulates with medial malleolus. Okay, so I think I have already showed you this, but here it is again. So here is the talus, goes under the tibia and fibula. Then practically right there is ankle joint. Okay. The other thing I want you to remember about the talus is on the posterior side, we have the posterior process with 2 tubercles. And as you see, there is a beautiful groove between these 2 tubercles. That is for the tendon of flexor hallucis longus. And then on the inferior side or inferior surface, let's say, of the bone, we have articular surfaces, one on the head, one on the neck here, and one on the actually shaft for the calcaneus. And here it is, there is a sulcus actually between these articular surfaces. This sulcus is known as talar sulcus or sulcus tali, sulcus tali. And later we will see that we have a sulcus on the calcaneus right here. It's called calcaneal sulcus, and together form like a tunnel. Is known as tarsal sinus. Tarsal sinus. That tarsal sinus is for the ligament. Since I do have the bone here, I can show you actually better view of the tarsal sinus. Right here on the lateral aspect is much more clear. See that right there? That is tarsal sinus for a strong ligament between the bones. Okay, so the next bone that we want to look at is calcaneus. Is the largest bone of the tarsal bone. Okay, it has the anterior side. You see that is like a it has 6 surfaces or 6 sides. Here is the on the anterior side articulation with the cuboid. Remember that was the cuboid right here. So then articulates with the calcaneus on the anterior aspect of the calcaneus. On the superior surface, we have articular surfaces for talus, and again here is the calcaneal sulcus. Okay, between the articular surfaces. On the posterior side, we have a bony projection known as calcaneal tuberosity right there, and that calcaneal tuberosity gives attachment to calcaneal tendon or Achilles tendon, really famous tendon. So when you trace the calcaneal tuberosity inferiorly, we reach to 2 tubercles, medial and lateral tubercles. That is medial tubercle, and later I will show you how you can find the medial tubercle, or how you can say this is the medial tubercle. Medial and lateral tubercles. They give attachment to the muscles on the first layer of the sole of the foot. Okay, that was posterior side. On the medial side, there is a bony projection here known as sustentaculum tali. Sustentaculum tali. And as you remember, I said that is the medial side. Then on the medial surface, then that's why you can say this is the medial side, and that is medial tubercle of calcaneus. So that sustentaculum tali supports the talus. On the lateral side, there is a bony projection known as fibular trochlea. Fibular trochlea. And then the last but not least, on the inferior side or inferior aspect of the bone, here is a bony projection known as tubercle, the calcaneal tubercle, that gives attachment to the ligament. Okay, the other tarsal bones that we want to see on this articulated foot are the navicular, cuboid, and cuneiforms. So for the navicular, it articulates with the head of the talus, has a bony projection on the medial side known as navicular tuberosity. Cuboid, just good to know that is cube shape, hence cuboid bone. And then for the cuneiforms, we have 3. We always number them from medial to lateral, number 1, 2, 3, or we can say medial cuneiform, intermediate, and lateral cuneiforms. And we have already actually looked at the metatarsal and phalanges. Now, since we are looking at the articulated foot, it's good to know that the name of some of the joints here. The joints here between the talus and calcaneus right there is called subtalar joint, subtalar, or talocalcaneal joints, or calcaneo-talar joint, doesn't matter. And then we have the tarsal metatarsal joint here. which is between the tarsals and metatarsals, and we have already actually looked at the metatarsophalangeal joints and interphalangeal joints.